Hey, what's going on? Dr. John Blenio here with High Amplitude Health, Chiropractic and Sports Injury in San Mateo, California. I am back today to answer the two questions that I had for you last week. The first question was, what is the primary cause of lower back pain? And the second question was, what can you do to make that lower back pain go away? So let's take care of the number one question. What is the primary cause of lower back pain? And that is excessively tight muscles. Muscles. Muscles are the problem. Despite what many doctors of chiropractic will tell you and medical doctors will tell you, it's not a bulging disc, it's not degenerative joint disease, and it's in most cases definitely not a herniated disc. What happens when you sit at a computer for too long or lift something very, very heavy and strain the muscles, or not take care of your body and exercise to keep the muscles strong, what will eventually happen is that those muscles will become severely tight. And when muscles become severely tight, muscles become painful. They essentially fatigue. Muscles can handle being tight for quite some time, but when they've been tight for many days, many weeks, many months, maybe even years, the muscles eventually fatigue. And when the muscles fatigue, that's when they start to go into a pain zone. So let's now talk about what muscles are specifically the problem. So you're feeling pain in your lower back. Maybe you're feeling it in your hip and in your glute. Maybe it's traveling down your leg, just that achiness, that pain that's going down the leg. Here are the muscles that are the problem, and here are the muscles that need to be addressed. Number one is the glute muscles. So there's about 9 glute muscles on each side of your butt.
1, 2, 3, 4, 5, 6, 7, 8, 9.
And those muscles become very, very tight. They're very powerful muscles. There are sprinting muscles, right? There are squatting muscles. Yes, you use the whole leg, but the hips are the primary. The primary glute muscles that become the problem are the glute medius and the glute minimus. This one's the glute medius, this one's the glute minimus. Let's rotate here, and you can see where they sit on the body. These are the primary cause of lower back pain. Those are the muscles that we want to address when there is pain. The other muscles are the hamstrings. Most of the people that I see who have lower back pain have excessive hamstring tightness, and the thoracic muscles. So the mid-back muscles, those muscles that are right on both sides of your spine in the middle of the back. The thoracic muscles that get tighter right here. All of these I'm going to touch. All of these on both sides of the spine, including your trapezius muscles. All of these muscles can become very tight and become problematic, and look where they go, right down into the lower back as well. So number one would be the glute muscles as the primary problem. Number two would be the hamstrings, and number three would be the mid-thoracic muscles. So let's address question number two. What can you do to make the lower back pain go away? There's a number of things that you can do. Number one would be get on a foam roller. I want you to roll your glute muscles, roll your hamstrings, and I want you to roll your thoracic spinal muscles. I also want you to roll your IT band, your quads, your adductors, which are in the middle of your leg, and you can even roll your hip flexors. There's definitely a technique to doing this, so I recommend you watch my other video for foam rolling for lower back pain. You can also use a massage ball to do this. Massage ball functions somewhat the same way as a foam roller does. And of course, you can see a sports injury chiropractor like myself. I definitely recommend that if you're going to see a chiropractor, you want to see a chiropractor who specializes in sports injury, because sports injury chiropractors tend to do something called myofascial therapy. And myofascial therapy is a method in which the doctor applies relatively significant force to the muscles to stimulate the receptors that are within the tissue to force the muscle to relax. It works very well. It's something that I do on virtually all of my patients, and it gets them better. 95+% of my patients who receive myofascial therapy from me get better, and they get better with long-lasting results. Then, of course, when I teach them how to roll, then they're able to take care of themselves, and if they do get tight, this isn't an issue that lingers for weeks and months. Lastly, get your spine adjusted. This isn't about realigning. Getting your spine adjusted improves motion within the spine. What we're doing is we're taking joints that are stiff like this and stiff like this, and we're bringing them back through their full range of motion so that now your spinal joints can flex through their full range of motion and rotate through their full range of motion. That's the beauty of spinal adjusting. So when you have spinal joints which move through their full range of motion, and you have muscles that have become much more relaxed, and you have muscles that are no longer so tight, the pain is reduced greatly, and in most cases, the pain is reduced completely. I want to thank everyone who commented on my previous video. Thank you, and you, and you, and you, and you. You all had really great answers to the questions, and everyone was pretty much on the right track. I'd like you to please like this video, and of course, subscribe to my YouTube channel. Thanks a lot, and I'll see you again with another video soon.